I'm Dr. Himanshu, Head of Department of Respiratory and Sleep Medicine at Artemis Hospital in Gurgaon. So sleep apnea is a very common condition where, quite literally it means in sleep, having apneas, which mean pauses in breathing during sleep. So when we talk about pausing, it's a whole spectrum, starting from snoring to actually hypoapneas, meaning partial obstruction to breathing in the night, to full obstruction. And this is quite a common phenomena happening every few minutes, and some people having every few seconds. And these are measured in the night. So that's the symptom of the syndrome of sleep apnea, and that has a consequence during the day, because sleep is not a unitary phenomena. It has different stages, it has different parts: dreaming sleep, non-dreaming sleep. So it's literally like an orchestra. The sleep apnea disturbs this orchestra. You cannot go onto the higher notes if you don't play your lower notes high. So it almost disrupts the architecture of sleep, and therefore you do not get the typical relaxing slow wave and the REM sleep, which causes daytime sleepiness. So this is per se sleep apnea. So when we talk about sleep apnea, we basically classify into three types. One is the obstructive sleep apnea, which is the most commonly thought and the more prevalent disease, and that's what I described. It was the obstruction to breathing happening in the night. There's also a central sleep apnea where you just do not initiate a breath. You are just lying there. For some reason, your brain does not get the right message, and then the message is delayed, and therefore you do not initiate a breath, and that is central sleep apnea. And there is also a mix of both. You could have an overlap between the central, and those are called mixed apnea. So these are basically the three types of sleep, and there are further subtypes and phenotypes, but yeah, this is grossly what it is. Good question. It is very similar to a question as to what causes any other chronic disease, like what causes diabetes. It is multifactorial. We understand it is an interplay between the genetics, the environment, and our lifestyle. So a number of things contribute to it. We cannot put it down to any one particular thing. We understand being obese, being fat makes it more likely, but that's not the whole thing. If you look at a lot of Japanese population, Chinese, they are not fat. It is just their facial asymmetry, so which comes down to genetics. Number of reasons very similar to any other chronic disease like diabetes, responsible for sleep apnea. The symptoms of sleep apnea are incredibly easy. It is a disease, as I say, is very incredibly easy to suspect. You would have a patient who's typically, I'll describe a typical patient who would be middle-aged men, a little obese, who would snore loudly, and the bed partner will often notice that they have pauses in breathing, and then they suddenly take a loud breath, sort of loud breath again. They'll have some degree of morning headaches, a degree of sleepiness, fatigue during the day. Some of the patients may also have a lot of polyuria during night. They'll go to the loo multiple times. Morning headaches, so these are the typical symptoms of sleep apnea. As I said, we have different questionnaires. In day-to-day clinical practice, it's very easy to know who are the patients at risk. It's just not a disease of the people reporting with snorers. It is common in patients who have a lot of nasal problems, people who have depression, people who have diabetes. Almost 60% of the type 2 diabetes are at risk of having sleep apnea. It's very common in patients who have congestive heart failure, especially the central sleep apnea. So it is very common and it exists in different groups. It is easily suspected by either a questionnaire. There is a stop buying questionnaires around these 5-7 questions that I asked, 5-7 symptoms, and it is we confirm the diagnosis by doing a polysomnography or a sleep study, which is an observing somebody's sleep overnight, including their brain activity, their eye movement. We look at how long these pauses are happening. Are the pauses hypoapneas or apneas, or how low the oxygen is dropping, how many times is this happening. So this is all very well monitored in the sleep study, and we also in the later part or the next night try and see what will correct this. So this is all encompassed in what is called as polysomnography or a sleep study. So there are in other words, who are the patients who are at high risk of sleep apnea? People who are obese, they are the ones. People who have nasal problems. The second one, people who have diabetes, type 2 respiratory diabetes. Patients with congestive heart failure, patients on dialysis and kidney diseases, people who are just obese. So, if you look at it, it's a vast group of patients who are at high risk of sleep apnea. So, the risk of not treating sleep apnea, it's almost like, I explain to my patients, it's like, somebody's throttling you in the night, but not doing it fully. Every night, if there is somebody who's actually sitting on your throat and trying to throttle you, not letting you breathe properly and decreasing the oxygen flow. So just think about that, think about a situation if it's very similar to that, happening. So your brain is deprived of the oxygen. It has consequences on the brain, on the heart, on the immune system, and you name it. Basically, it will involve all the systems of the body. Some of the established risk factors are the increased risk of stroke, increased risk of hypertension, new onset diabetes, uncontrolled blood sugar, increased risk of heart diseases, atrial fibrillation. So you name it. It is endless list, and it is only getting. There is also some new evidence that it's linked with cancer and other problems. So it is a mechanical problem, as you know. There is physical obstruction to breathing, and that's happening only in the night. So it's quite a dynamic disease, a mechanical problem happening in the night. Therefore, the answer has to be mechanical. We will have to make sure that the air that you're trying to breathe gets to your lungs. So, and we have to overcome this pressure. The most commonly used treatment is a pneumatic splint, or a airway splint, as we call it. The CPAP, continuous positive airway pressure, which is like a small machine which sits on your bedside with a mask, and that delivers the pressure. It overcomes that pressure, and you are able to, it synchronizes with your breathing, and you're able to breathe well through that. So that's the gold standard treatment, or the CPAP therapy. There are different types of devices within this, PAP therapy, one may call it. And then also there are the dental devices which are also available these days, where you can actually move forward your mandible or the tongue and make sure there is an airway. Some of these patients are also can be considered for surgery if they have, for example, nasal polyps or nasal obstruction, but it's not the mainstay of treatment, one must remember. But yes, that's also an option that exists. So it's quite a irony and a tragedy that we look at. If you drink alcohol, and if you were to walk down the street, that there'll be somebody who will check your alcohol level, because why are they concerned? Why are they concerned about with you driving with alcohol? Is because you're a risk to others. You're a risk to others' health, and therefore that is not something that can be permitted in the society. Very similarly is the risk of excessive sleepiness. Either you're sleep deprived, or you have one of the sleep problems like sleep apnea, and you're not awake, alert. So the level of alertness and the impact is very similar to alcohol consumption versus you look at some of the major industrial accidents, and sleep apnea has played a major role in all that, and nobody's talking about it. We see these accidents every day. Nobody's at least in India is screening people for sleep disorders or sleep apnea as a major cause of these accidents which are happening in the night. So some of them we just spoke about, some of the known problems it can impact. Starting from your brain, it can cause you mood, memory, concentration. It can cause depression. Besides the diabetes that I've described, new onset diabetes can worsen your blood sugar control. It can cause arrhythmias and atrial fibrillation. There is an increased risk of having new heart attacks or MI. You could have the problems with your immunity, the problems with your GI system. So it basically impacts all the systems of the body. It is 1/3 of our lives. So sleep is a window of somebody's health, and if you're not sleeping well, it's bound to impact all other functions. Well, it is a two-way relationship between diabetes and OSA. People who have diabetes are the ones who have increased risk of having sleep apnea, and sleep apneics have an increased risk of having diabetes, and both of them fuel each other. It's a vicious cycle. So the International Diabetes Federation has said that all type 2 diabetics should be screened. So the prevalence they have said is as high as 58%. So 58% of type 2 diabetics, and this is a statement by the International Diabetes Federation, are at higher risk of having sleep problems. And if you correct their sleep apnea, their blood sugar control gets much better. And if you pick up somebody's sleep apnea, you decrease the risk of having new onset diabetes. So that is the relationship between both of these. And why does that happen? It is because when you tend to have those micro arousals, as your oxygen drops, you tend to have those micro arousals for 4 seconds. You have a sympathetic drive. It is like a surge of a sympathetic system which increases the blood sugar, and it causes that, and also the hypoxia and the injuries that happen because of that. So it's quite a wide spectrum, as you know, cardiac diseases. The most common established heart factor is the atrial fibrillation. When you have arrhythmias of the heart is not pumping well, and the more the severe the obstructive sleep apnea, and the more is the prevalence of atrial fibrillation. And once you correct it, it gets better. Now, what are the pathways that link both these? It's not clear, and the hypothesis is it's probably to do with constant hypoxia and constant loss of oxygen, and then suddenly there is increased oxygen. So that pathway, which also causes the injury and causes heart attacks, is a similar pathway what the sleep apnea causes to the heart. So it increases risk of. There is a strong relationship between congestive heart failure and central sleep apnea. What is believed is that when people have congestive heart failure, they cannot get the blood circulation slows down, and therefore the message of the oxygen and the carbon dioxide concentration to the brain is delayed. And these are like, you have an AC which is thermostat is not working well, and you have an AC which works for some time and then stops and then works. So similarly the body works, and it goes into the cyclic chain stroke breathing pattern, and that's a relationship. And the prevalence is almost 40%. Congestive heart failure patients will have a degree of sleep apnea, and they are hard to treat. So all these are the established relationship of these problems. It is not very well established. Some of these we know there is a relationship between depression and sleep apnea. It is often very hard to pick up what is what. Insomnia, depression, sleep apnea, they are intermingling with each other. There is some evidence linking it with some of the Alzheimer's and the extrapyramidal. There is a relationship with Parkinson's and the drugs that we are using for Parkinson's and the neurological conditions. Again, not very well established relationships. So I'd say basic hygiene of sleep. In sitting in NCR, I think we must emphasize that we have to give sleep a priority. It has to be not something we can take for granted forever. People are just not sleeping, allowing themselves enough sleep. They're living in Gurgaon, working in Faridabad, spending 4 to 5 hours on the road, just don't have time to sleep, and therefore there are so many other things to do, and then they come home, they're Facebook and so many other. There is so much incentive to stay awake that they forget about sleep, or they cannot, and there is a heavy price that they pay around it. So one is to make sleep a priority, making sure that and we see these patients come to us for health checks every day, and then none of them are talked about sleep. They check their blood sugar, they look at the blood, they do an ECG. But one of the things that is commonly missed is they're not screened for sleep apnea. So there's a strong message, I think, for all the health professionals that is 1/3 of their lives, and which we are completely missing out. We should pick that up. Thirdly, snoring is not just a sign of glory and good sleep. It often means you have sleep apnea. You should, I think one has to be aware about it, has to get this diagnosed and then get it treated. The fourth is, I think, some of the things around having a good sleeping environment or a good sleep hygiene, which is good bedroom, and should be quiet, should be have fixed sleeping times, allow yourself enough hours of sleeping. So I'd say, let as a nation wake up to sleep. As a nation, we cannot achieve prosperity at the cost of our sleep. If you think we can, I think the price as a nation, as a society, we will pay to work on that is going to be huge. So one of the things that we have to as a nation understand is that it is a very scarce resource. It has been given to us by the God. We must respect it and then care for it.